Okay, so next we'll talk about the pharmacology of disinfectants, antiseptics, and sterilants. So I have a confession to make. This section is not going to be as interesting as the others. It's just going to be too much memorizations. I'll try my best to focus on the concepts, okay? So we have some definitions, unfortunately, we have to know, because as pharmacists, when we are told this chemical is a disinfectant, you should differentiate from what's a disinfectant versus what's a sterilant versus what's an antiseptic, okay? So we have some definitions here and here. Let's just go through them really quick. So disinfectants are chemical agents. So they're chemical agents or physical procedures that inhibit or kill microorganisms. We have antiseptics. So these are chemical agents with sufficiently low concentration to the hosts that they could be used directly on the skin and wounds and tissues. Okay, so just to keep in mind that some of the agents could not be applied to the skin or to the wounds, but others can. Sterilants, they kill both vegetative cells and spores, which are viruses, when applied to materials for appropriate times and temperatures. Okay, let's look at further definitions or actions. So we have antisepsis, application of agent. So these are the actions, not the definitions, but they're related. These are like application of agents to living tissues for the purpose of preventing infection. Decontamination, the process that produces marked reduction in the number of or activity of microorganism. Disinfection destroys most vegetative microbes, viruses, but not spores, or an inanimate inanimate surface. Sterilization, reduction of microbial load to a level considered acceptable for the public health purposes. Sterilization, so there is sanitization, sterilization. These are intended to kill or remove all types of microorganisms, including spores, usually including viruses, acceptable, however. Pasteurization, the process of killing the non-sporulating microorganism by hot water or steam. So ideal question would be matching. Okay, you have definitions, match the definition, that the term with its definition. Makes sense? So unfortunately we have to do that. Okay, any questions about those? Yes.
When you mentioned, at least for disinfectant, destroys most vegetative. What is a vegetative microorganism?
Okay. I can't remember, to be honest, the vegetative now. Vegetative microorganisms. Can you check it really quick, Eric?
I will.
Okay. Hey Siri, what is vegetative microorganisms?
It's from the freedictionary.com.
Never mind.
Vegetative microorganisms are the growing forms of bacteria that form endospores.
Okay.
Microbes are found in other.
Okay. All right, so just make sure you're able to match the definitions with the terms. It's okay, Eric.
I'm still gonna.
It's okay. And then we have this table here. You don't have to memorize anything. Again, this is just to relate the concept that there are certain, I guess, bacteria or viruses that are highly susceptible. That's what HS stands for. Some are susceptible, some are resistant. So highly susceptible, there is moderately susceptible, and there is resistant, there is susceptible, and there is things that are variable. Also, from this table, we would see that there are certain chemicals that act within certain pH value. So apparently, the pH plays a role in the activity of these chemicals, okay? And there is also certain chemicals that act on certain concentrations, okay? So the take-home message from this table is that we have different kinds of organisms that are susceptible or highly susceptible or not susceptible, okay, to the chemicals. Also, different concentrations of these agents could have effects on certain organisms. So for some organisms, as we will see soon, you will have to administer you have to give higher concentrations to achieve the effect. Others would need less concentrations. And then finally, pH of the environment also affects the action of these agents, okay? So you don't have to memorize anything from this table, just catch those concepts, the effect of these pH, concentration, and the different types of susceptibility of the organisms. Make sense? So you could come back to this table in the future if you have certain, viruses or bacteria, and then you want to find out, which agent works best for them. Okay? Any questions about that? All right. Now let's start with some of these agents. So to start with, this infection prevents infection by reducing the number of potentially inactive organisms. They can accomplish by application of chemical agents or physical agents such as radiation, ionizing radiation, dry or moist heat. Often combination of agents cause this infection. Prevention achieved by washing. Okay. Hand hygiene is probably the most important means of preventing transmission of infectious agents from person to another. Alcohol-based and drops can kill bacteria. Skin disinfectants with detergent and water are usually used prooperatively as a surgical scrub for hands. Okay, for team members, disinfection does not make cause. Most typical antiseptic or wound healing. Okay, so you could just use that for your own information, really. It's just good to go through them, read them together. You hear them one time, hopefully you will get a general idea about these applications. Okay. Right. So we will also see that some of these agents has mechanism of actions. So we'd have to know these mechanism of actions. Okay. So speaking of alcohol, for example, its mechanism of action is by denaturation of the proteins. Okay. So there are two most frequently used kinds of alcohol: ethanol and isopropyl alcohol. You would see these in the market. Okay. The optimal concentration for bactericidal effects is 60 to 90. Now, do not memorize the concentration. Just keep in mind that there is certain concentration that has the concentration for alcohol that has to be present to get the bactericidal effect. I think in the pharmacy I've seen 70% and 90%, right? Okay, which makes sense. So they are above the threshold here. We talked about the mechanism of action. They are not used as sterilants because they are not sporicidal. So I guess among the definition of sterilants, they have to be sporicidal. So they don't classify as sterilants. Do not penetrate protein-containing organics. They may not be active against hydrophilic viruses. One of the things that alcohol causes, if applied to skin, is actually dry skin, and so they're usually combined with emollients. You've probably seen those alcohols formulated with the aloe vera, so they use emollients to prevent the dry skin. Okay. Some of their spectrum of activity. Of course, Alcohol is flammable, should be stored in cool and well ventilated areas. They must be allowed to evaporate before cautery, electrosurgery, or laser surgery. May be damaging if applied directly to corneal tissues. You should avoid applying them to the eye, of course. What else? Should be rinsed with sterile water and should be allowed to evaporate if applied to instruments. Any questions about alcohols? So far, so good. All right. Right. Chlorhexidine. This is the structure of chlorhexidine. As you can see, it has so many nitrogens, which means it's going to form a base, positively charged base, and so it would require the presence of another negatively charged ingredient. So it's usually combined with the biguanide. Okay. I'm sorry, this is the chlorhexidine biguanide. It's usually combined with digluconate. So you'd have the water-soluble chlorhexidine digluconate is the form that you would see in the pharmacy. You've probably seen that in the pharmacy. Chlorhexidine digluconate, no? I think it has a special brand name too. You guys remember? Chlorhexidine, Peridex, thank you so much. Yeah. Okay. So it's active against vegetative bacteria and mycobacteria and variable fungus and viruses. Strongly absorbed to the bacteria. So that's the mechanism of action of chlorhexidine. Absorbs to the bacterial membrane, causing damage to the membrane, and so leakage of the small molecule and precipitation of cytoplasmic proteins. Okay. Slow in its action on slower action than alcohol, but because of persistence, it has residual activity, producing bactericidal effect. This is spectrum of activity. Chlorhexidine is resistant to inhibition by blood and organic materials. However, anionic and anorganic agents in moisturizers may neutralize its action. Concentration 4%, greater antibiotic activity than the 2%. Okay. Combination of chlorhexidine and 70% alcohol, available in some countries, including USA, preferred agent for skin, antisepsis, and many. So it could be combined with alcohol. What else? Advantage of the combination over this ingredient may derive from its more rapid action after application. Has a low skin sensitizing or irritating capacity. So unlike alcohol, it does not irritate the skin. Okay. Oral toxicity is low because it's poorly absorbed in the GI tract. Chlorhexidine must be used during surgery. Must not be used during surgery in the middle ear because it causes sensorineural deafness. Oh, that's interesting. Okay, but not to memorize, I guess. Just we're going through these just interesting information, I guess. Questions about chlorhexidine? So far, so good. Okay. There's also halogens, and I think the take-home message from halogens is the fact they have so many different concentrations that could be used for certain applications. Okay, so there is 1 in 20,000 solution that's bactericidal in 1 minute for to kill the spores, and in 15 minutes. So bactericidal in 1 minute and 15 minutes for the spores. There is tincture of iodine that contains 2% and 2.4 sodium iodine alcohol. There's something also called iodophores, which is complex of iodine with polyvinyl pyrrolidone, PVP. Kill vegetative bacteria, mycobacteria, fungal. They may be sporicidal with prolonged exposure. They are less irritating for to the skin, So far we had alcohol is the one that's causing most irritation. Chlorhexidine and halogens have less irritation to the skin. Any questions about halogens? Continuing with the halogen, we have chlorine. So we talked about iodine, and then we also have chlorine. The same with the concentrations. So you'd see a dilution 1/10 versus concentrations of 1,000 to 10,000 parts per million to be tuberculosis. So just a general concept that, they could be present in different concentrations, and these concentrations could affect different types of viruses and bacteria, okay? Of course, we have the sodium hypochlorite, which is the household bleach, like Clorox. Any questions about chlorine? You have to memorize everything, yes. No, you didn't have to memorize it, sorry. Just the definitions I talked about early, and then mechanism of action, and what else? The concepts that, having different concentrations, but do not memorize concentration, okay? Any other questions? If you're not sure, just shoot me an email. Should we know that? Should we memorize this? If you forgot, okay? So, no, I mean, I don't relate the things I underline. I just go through, I underline it because I'm reading them, but not because you need to know them, okay? So from here, I mean, there's nothing to memorize here on this slide, to be honest. Just the fact that those halogens, or even in general, different concentrations, the concentration is important factor in determining the action of these ingredients, okay? So just so you would pay attention, if I want to apply something to treat certain disease, or or to disinfect something, just keep in mind that concentrations matters in this case, okay? All right. Phenolics, of course, phenol, the most or oldest surgical antiseptic. It's no longer used as disinfectant because its corrosive effects on the tissues, okay, just like with the alcohol. Except the other one was more irritating. This is more, I guess, corrosive to the skin. These adverse actions are diminished by forming derivatives. So they have formed derivatives of the different phenolics, such as phenol, benzyl, parachlorophenol, and tertiary amyl phenol. Mixtures of phenolic derivatives may be used, some of them derived from the coal tar distillants. Detergents, phenolic combines, disrupt cell wall. Okay, so the mechanism of action. They disrupt the cell wall and membranes, precipitating protein and inactive enzymes. This is something I would expect you to know. Which actually, I think it's similar to alcohol. Here, the alcohol is denaturation of proteins. This one is disrupting cell membranes, and precipitating protein.
I think it's similar to
Chlorhexidine. Okay, I think that's what I thought. Okay, because I've seen it before. Yep. Okay, disruption of the bacterial membranes. Except we also have this does affect the cell wall as well. Okay. Any questions about the phenolics? Right. We also have quaternary ammonium compounds such as benzalkonium chloride. They're also known as quats. Let's see. course, they have fungicidal, sporadic, bactericidal. They act on the viruses lipophilic. I didn't see their mechanism of action here. Anyway, so just general information. Aldehydes. I think what's interesting about aldehydes is the fact they are used as disinfectant or sterilization for instruments, such as endoscopes, respiratory therapy equipments, hemodialyzers, dental instruments, things like that. So formaldehyde, glutaraldehyde are used for instruments. Okay, they're not corrosive for metals, plastic, or rubber. Makes sense, right? Because that's what instruments are made of, right? So we should they shouldn't cause any damage to those metals, plastic, or rubber that instruments are made of. Let's see. Dynamic circulation. Some concentrations, like formaldehyde, is available in 40%. There's formalin, 100%, 80%. Okay, that's all for the aldehydes. And then we also have glutaraldehyde, that's another example also. Formaldehyde. Okay. Any questions about aldehydes? Okay. Superoxidized water. Okay, so these are electrolysis of saline yields mixture of oxidants, primarily hydrochlorous, chlorine. The solution generates the process ester oxide. Peroxygen compounds like hydrogen peroxide. We've seen hydrogen peroxide. It's like a commonly used disinfectant and sterilant. Okay. I think they have a mechanism of action here. Organisms that produce enzymes catalyze peroxide rapidly. No, that's their inactivation. Anyway. Okay, now switching from the chemicals, there's something also such as ultraviolet irradiation. These are nice in case you do not want to expose any of the materials or instruments to any chemical. So you could use ultraviolet irradiation as an alternative, okay, for products that you do not want them to be exposed to chemicals. Okay, it would basically eradicate the vegetative bacteria in less than 25 minutes. Okay, but the C. difficile in 1 hour. And then we also have something like the heavy metals such as silver, silver nitrate, silver sulfadiazine, which we talked about already at different concentrations. And then we also have the sterilants such as steam at these temperatures, high temperatures for 30 minutes. And we also have the preservatives. Sorry. We have preservatives such as the benzoic acid or parabens. So these are used in, for example, eye drops to protect the solution from bacterial infection, and at the same time they shouldn't cause. So they are present in certain concentrations to protect these solutions without causing damage to, like, the eye in this case. So I know this is not our favorite part, but just focus on some of the mechanism of actions we talked about, and the matching of the definitions. The rest of the information, I had to read them just so we could go through them, so you at least heard about them. Questions? Yes?
Is it possible to provide us with a review?
A review?
Of like what we need to know?
So you mean like for what? For the
For both of the
both materials? I usually don't, to be honest, but I mean, I try to explain everything during lecture. If you're not sure, just shoot me an email. Sorry. Yes.
Can I ask, like, for this PowerPoint specifically, like, what should we just focus on? Because it's a lot of, like, block text.
Okay, so only the mechanism of actions for some of these. So the question was which ones we should focus on. Only mechanism of actions for the ones we mentioned. Like we talked about mechanism of action. What is it? For phenolics, right? And then we talked about mechanism of actions for chlorhexidine. Okay, and then we also talked about mechanism of actions for alcohol. Okay, denaturation proteins. And the concept from this table, which is the parameters that should be taken into consideration when making selection to a chemical, which is how the bacteria or the virus or the fungus is susceptible. So are they highly susceptible, moderately susceptible, or not resistant, and the impact of different concentrations and pH. Those three parameters. I just want you to know that these are parameters that influence our decision, but you don't have to memorize anything in this table. And lastly, just to finish, those definitions. Make sure you are able to match the terms with their definition. Does that help?
So for the other table, don't, like, memorize, like, the exact specific details of it, just understand, like, what's susceptible, resistant.
Exactly. Do not memorize anything in this table. Just know that there are factors involved in the selection of the drugs, which are their susceptibility and the different concentrations and the different pH. Okay? Sure. Yes. So this has definitions. Yes. So I want you to be able to match the definitions with the terms. Okay? Questions? Eric?
Well, this is more generalized, right? You mentioned like ultraviolet. I know that there's like some specific products that are like, oh, you could put this on a surface and it could be able to go and clean it. I'm not sure if you know this, right? But do you know those are actually truthful, viable products, or is it just blue light?
I didn't have, I mean, unfortunately, I didn't have experience in the hospital. I mean, all my experiences were in retail, so I never get exposed to these things. I haven't seen it. Yeah.
I don't know. I just seen products of these, and I don't know if they're true.
Yeah, I mean, I would guess, I mean, there must be some, like, I guess, people who specialize in those things, and they would have to know all these information, really. So if you specialize in, disinfecting these chemicals, but even in that case, you always have a protocol. Like, before a surgery, you have certain protocols that you would do for these chemicals to store them for next time, so.
Okay.
Okay,
Okay. Thanks.
sure. Any other questions? Any questions about the exam? Okay, if you remember anything, feel free to email me, okay? And good luck with the exam and happy Thanksgiving.
Thank you. You too.
Thank you. Take care.
Do you celebrate Thanksgiving?
Yeah, sure. Are you gonna cook? Just kidding.
I don't. I could cook a cup of ramen.
Yeah, sure. Sure, how you doing?
Just one quick question.
It's just